The Detroit Regional Chamber's MPC20 Conversations Respond and Rebuild digital series is provided in partnership with Detroit Public Television and presented by Blue Cross Blue Shield of Michigan, with additional support from Accenture, Bank of America, Barton Malow, Comerica Bank, Consumers Energy, Delta Dental, Dow, DTE Energy, Enbridge Energy, Ford Motor Company, Huntington Bank, ITC, KPMG, the Kresge Foundation, Kroger, Michigan Economic Development Corporation, PNC Bank, Ralph C. Wilson Jr. Foundation, Rocket Mortgage by Quicken Loans, the Skillman Foundation, and TCF Bank. And by these supporters. Support for Detroit Public TV's coverage is provided by DTE Energy Foundation and Masco.
We're here for it all. Day 1 to year 100. The times you remember and things you'd rather leave behind. Standing by for the late nights, the midday surprises, and everything in between. We're here for it all, and always will be. Blue Cross Blue Shield of Michigan. Confidence comes with every card.
Make today a new you had it in you day. Make today a we need a bigger trophy case day. Make today a learning the basics day. Make today a finally going in on season tickets day. No matter the day, PNC has the financial tools and technology to help. PNC Bank. Make today the day.
Greetings and welcome to MPC 20 Conversations, Respond and Rebuild. This is a 13-week digital series that will bring smart dialogue focused on our unprecedented challenges to Michiganders across the entire state. Thank you to the Detroit Regional Chamber, Detroit Public TV, and the many corporate and philanthropic partners for bringing the spirit of the annual Mackinac Policy Conference to us virtually during this critical time when an in-person event just wasn't in the cards. Today's discussion will relate to Michigan's COVID-19 response and recovery. I'm pleased to bring you this session sponsored by PNC Bank. Enjoy.
Thank you for having me join the conversation today. This has certainly been a year that none of us could have ever imagined. When we at the State Health Department started seeing what was coming out of Wuhan, China in late December and early January, we were already watching closely, speaking with the CDC, and developing plans for how we would respond as the State Health Department. The first identified cases of COVID-19 in the United States were in late January, and we quickly began to understand just how easily it could be spread between close contacts. I think a real turning point in the country was when people started being diagnosed with the disease who had no known travel history and no known personal contacts who had had the disease. This meant that there was general community spread happening. And from there, it really started spreading quickly throughout the United States. In Michigan, it became clear that it was really going to be a matter of when and not if COVID-19 would come into the state. So on February 2nd, Super Bowl Sunday, I received notification from the CDC that people on flights from Wuhan and other places in China would be funneled into the Detroit Metro Airport, one of 11 airports that has such designation across the country. And I was actually informed that they would be coming in the following morning. So at the State Health Department, we jumped into action. We brought together local health departments to start talking about processes for quarantine and what we would do if a person was identified who was under investigation for having the disease and they needed to have a medical evaluation. Around the same time, we began communications with our healthcare systems. they were going to have to be prepared to take care of people who potentially had symptoms of COVID-19, but they were also going to have to start preparing their hospital surge plans in ways that they had probably never done before. In the meantime, at the state health department, we had to start working on the ability to test. And that's incredibly important. I think that there's no question that when the history books are written about how the United States responded to COVID-19, we were painfully slow with developing testing abilities, and that really led to the virus taking hold across the country. In the very early days, in February, the only lab able to test for COVID-19 was at the CDC in Atlanta. And initially, because of limitations on testing across the country, there were very strict criteria for who could even obtain a test. They had to have severe disease, or they had to already be in the hospital, or have a history of travel to particular countries. And while I don't know that we will ever be able to determine who the index case was in Michigan, so the first person who had the disease, whether they had a test done or not, I know that it was very likely that there were people in our state who had mild symptoms and simply could not be tested. And I'm pretty sure that the disease was likely spreading well before we identified our first 2 positive cases on March 10th. So I think we all know what happened from there. Given the severity of this disease, how infectious it is, the fact that there's no vaccine, no approved antiviral treatment, and quite frankly, the fact that we're still trying to determine what the potential long-term health impacts of having this virus are, the governor really had to move incredibly quickly to slow the spread of the disease as much as possible. And on March 23rd, she issued a stay home, stay safe order, which required people to not leave their homes unless it was for essential work or to get food or medicine. She also issued a series of orders related to healthcare, including limiting non-time sensitive procedures, limiting visitation, and expanding the scope of practice for some healthcare professionals. So where do we stand now with COVID-19 in Michigan here on the beginning of September? So Governor Whitmer's strong orders, and quite frankly, I'll say the will and resolve of all Michiganders, hospital leaders, business leaders, we really were able to bring our cases down significantly. In March and April, we were seeing over 1,500 cases a day. And some days we announced over 150 deaths at our peak. In our hospitals and emergency departments, including Henry Ford, we have the CEO, Wright, Lassiter, here to talk about that today as well. They were particularly overwhelmed in Southeast Michigan. And together, we were able to bring that curve down. And in late May, we began slowly reopening the economy with the governor's executive orders. Unfortunately, we started seeing an increase in cases after that. And the governor needed to tighten up some of her orders around things like wearing masks and dining in indoor bars. As of right now, we've hit a bit of a plateau, and we're really not seeing the decline in case rates that we would like to see from an epidemiology perspective. And as many people are aware, we continue to see outbreaks occurring in all areas of the state, whether it's nursing homes, social settings, daycares, schools, restaurants, and other settings. I will say, though, we have had some successes. We've significantly improved our testing. And right now, we're testing over 2% of our population a week, or about 30,000 tests per day. And as of last week, we were 5th in the country when it comes to the number of tests that we are conducting. If you compare Michigan to other states, we're 31st when it comes to the rate of new cases, and that was last week. And we also have the 39th highest percent of tests that are conducted that are positive, so that percent positivity rate that we often talk about. So by and large, we're actually doing a lot better than most states in the country. While that's how we're doing in the state as a whole, we also have to look really closely at a regional and even a county and city level to understand how COVID-19 is spreading. In the Detroit metro area, for example, the city of Detroit has a lower case rate and percent positivity rate for COVID-19 than some of the outlying counties such as Oakland, Wayne, Macomb, or Monroe counties. And so that's why it's really, really important that businesses and hospitals and schools work closely with their local health departments so they can understand the spread of the disease and implement the appropriate measures to be able to slow the spread and contain it as much as possible. So I'll just say that, while 2020 has been an incredibly challenging year, we're all going to have to remain incredibly committed to fighting this disease. Even when a vaccine becomes available, and I certainly hope it will be so this winter, it's going to be some time before we have broad uptake of a vaccine. And the immunity in the population is such that we can sufficiently spread the disease without implementing some of these aggressive measures that we've had to do this year. And this fall will be particularly concerning because we will have both flu and COVID-19 circulating. And we know that what that can do as far as people needing to stay out of work or school, or hopefully not, but it could potentially overwhelm our hospitals again, like we saw in the spring. And so I'm optimistic that we're going to persevere, but it's going to take some patience and dedication and commitment on all of our parts to be able to do so.
Hello, I'm really pleased to join MPC20 to talk a bit about the COVID-19 pandemic and Henry Ford's response during this unprecedented time in our state and in our country. And I would start by saying that in the healthcare industry, individuals like myself, CEOs of healthcare companies, are blessed with leading and supporting tremendous talent and tremendously dedicated healthcare workers who spend their lives working for those communities they serve. And so at Henry Ford, we have 35,000 team members who have worked tirelessly since early March to ensure that themselves and our community is safe and responding well to the COVID crisis. As I reflect back on what seems like a lifetime, but just a few months ago, we know that our state was first impacted by COVID in early March. And as we listened in January and February to the experiences around the world, certainly China, Italy, then the state of Washington and New York State, it was clear that at some point in time, Michigan would be impacted. I would certainly say that in late February, I had no idea how significant Henry Ford, Southeast Michigan, and our entire state would be impacted by the coronavirus. As you heard from our state medical executive, the first case was reported in Michigan on March 10th. And at Henry Ford, we saw our first patients on March 14th. I think what is useful to comment on is that hospitals spend their time on a regular basis preparing for crises. We prepare for surges, we prepare for mass casualty events. We have surge plans in all our facilities. And throughout a healthcare career, you would lead an organization once, twice, maybe three times where one of your hospitals would be impacted. This scenario was so unique for the healthcare industry because at Henry Ford and frankly at every hospital system in Southeast Michigan, we had to implement a system-wide emergency response plan. So at Henry Ford on March 13th, we activated our executive steering committee, and a few days earlier, we implemented incident command centers at every one of our hospitals. And we also implemented a system incident command center to ensure that we could respond across our system, because it was becoming clear that every one of our hospitals in Southeast Michigan and in Central Michigan would be impacted by COVID at some point in time. Never in the 105-year history of Henry Ford have we had incident command centers up and operating in every hospital at the same time, along with an incident command center and an executive steering council meeting daily, multiple times a day, to ensure that we had safety as a premier concern for our team members, safety of patients, and obviously the best quality that we could possibly offer. So when we had the impact of our first patients come into our system, we had no idea how large the surge would be. And as you heard from our state's chief medical executive, Southeast Michigan was hit extremely hard. We put in place a surge plan where we increased our intensive care bed capacity by 50%. As we began to fight the coronavirus, we had only a few patients in our hospitals. By our peak, which happened, frankly, about 3 weeks after our first patients were seen, we had nearly 1,000 patients across our system, COVID positive or presumed COVID positive. We think about the impact of that to an organization. It was somewhat like managing massive MASH units, where you had the sick and wounded coming into your emergency departments on a daily basis, and frankly, overwhelming your staff. You've heard in news reports and you've seen lots of commentary around supplies, PPE, masks, gloves, gowns, face shields. And I would say to you that what you've heard in the press reports were very accurate. I've been in healthcare for 30 years, and honestly, at no point in time have I ever had concerns about supplies and equipment for my staff as I did in the March, April, May, and early June timeframe. It is very, very clear that the global supply chain that supports the healthcare industry, which we all believed was more than sufficient, is not sufficient for a global pandemic. It's very, very clear that leaders like myself had to put plans in place to procure PPE in a manner that we were not accustomed to. I recall many late nights with our financial team talking about cutting POs and wires for international activities to ensure that we could get PPE available for our staff to make sure we kept everyone safe. During the coronavirus crisis thus far, we have treated almost 5,000 patients in our hospitals, about 4,800 in our hospitals. Again, as I mentioned, at the peak, we had nearly 1,000 patients. Today, we're down to about 100 patients. And so you might say, well, geez, we're out of the woods and everything is just fine. I would tell you that, as you heard from our chief medical executive of the state, we're all very concerned about potential additional surge in the fall related to the flu vaccine. But more importantly, what healthcare leaders are very concerned about is the toll that the coronavirus has taken on staff. During this process, our nurses and our care teams and our physicians went above and beyond the call of duty, day in and day out. You might ask, well, isn't that normal? It is from a care perspective. Our nurses and our doctors certainly put in 100% effort on a daily basis to ensure that our patients have safety. Unfortunately, during this pandemic, when it was really clear, based on the governor's orders and based on medical science, that hospitals should reduce to the bare minimum any additional traffic, any excess traffic in our facilities. What's not really known outside the walls of the hospitals is that our caregivers stepped in as surrogates, as family members. On many occasions, our caregivers were holding phones for an individual to say goodbye to a loved one because a loved one could not be with them as they were going through their last day or hours on this earth. And so I'd say that our healthcare teams are in a bit of post-traumatic stress syndrome. They love their jobs, they love what they do, they're committed to it, but they're really concerned about their own mental well-being. And so our organization, like most healthcare systems, are spending significant amounts of time during the crisis and ongoing with ensuring that we provide the kind of support for our team members that will allow them to come through this crisis in a way that maintains health and well-being. And that is one of our biggest concerns today. Happily, as our state has done an amazing job with maintaining its presence and its response during this crisis, we're at a place now where we can certainly care for coronavirus patients. We can care for the community who has needs that haven't diminished during this crisis. And we can also prepare effectively for any additional waves or surges that may occur during the fall and beyond. I'm so proud of the response of our team members. I'm so proud of our organization and the healthcare industry in this fight. And I look forward to having further discussions about the impact from an economic perspective and from a care perspective as we think about bringing Michigan back to its fullest potential.
Well, first of all, thanks to the Detroit Regional Chamber for hosting this. Obviously, this is the big topic of discussion across the state right now. There's so much to cover, plans for reopening and whatnot. But one of the things I was going to start with you, Dr. Khaldun, but anyone can pick it up. You've spoken about the nexus between dealing with COVID-19 and the flu at the same time. And we know that in crisis management, there's a famous phrase, there are the known knowns, the known unknowns, and the unknown unknowns. And in those last two columns, starting with Dr. Khaldun, what are the things that most concern you in terms of what we don't know about what might be coming?
Right. So, I mean, I think that's been the story of this entire pandemic. Don't have a crystal ball, don't know how people are going to respond to executive orders, don't know how well people are going to wear masks and socially distance. But what I do know is that we are going to have flu this year, like we do every year across the country. And I know that we are likely, it's very possible that we're going to have a surge of COVID-19 cases again. And I think that's very likely because, again, it's getting cooler. People are going to be coming inside. We have schools coming back. This disease does not care. This virus is very contagious. It does not care. And I think it's going to likely increase. I certainly hope that the measures we have in place will not allow it to surge like it did back in March and April. But I know we'll have flu and COVID circulating this fall. And that's why it's so important that everyone gets their flu vaccination this year. They should get it by October. And we've set out a goal of increasing by 33% the number of people who get a flu vaccination in the state of Michigan this year.
Is there any additional incentive that the state can offer above and beyond what we've seen in past flu seasons?
So we are working with the Michigan Hospital Association, with the Michigan Primary Care Association. We've launched a campaign. We launched a campaign last week, Facing the Flu Together, to really get the message out that flu vaccination is important. We're also providing actual vaccines to our local health departments and to our community partners so that they can actually provide it as well. I think this is an important point. What's happened over the past several years, local health departments don't normally actually provide flu vaccination for the general community. We do for a subset of people, particularly lower income children, for example, through our Vaccine for Children program. But for most general adult flu vaccinations, that's kind of gone out into the pharmacy world. And so we're really working with our pharmacists to make sure they're getting out there, partnering with community organizations. We're working a lot with, again, the hospitals to make sure they're thinking innovatively about how they can provide flu vaccination as well. I know Mr. Lassiter can speak to that as well.
And same question to you, Mr. Lassiter. How do you manage the unknown aspects of this?
Thanks for the question. I would say that, as Dr. Khaldun mentioned, there are significant challenges here, but what we try to do is make the problem as small as possible, right? So, we have a public health sciences department within Henry Ford Health Systems that helps us look at projections around the potential flu challenges, as well as layering on top of that COVID-19 challenges for the fall. And we also know what happened in the state a few years back when there was a significant flu outbreak, and there are models that help you take a look at what would layering COVID on top of that do, and how many cases might that present, and how would you respond? And so as we look at that data, we're focusing very significantly on ensuring that in all of our ambulatory locations, and we have 200 plus ambulatory locations, that we're ready to provide support for our patients and our members related to flu vaccination. And so we're gearing up for that process. We certainly do that at our hospital-based locations, but we know that our community-based locations closer to where people live are the better places to get that done. And so we're focusing on that as much as we can. Obviously, we don't control the supply of flu vaccine, but we're working very aggressively with state and local support to ensure that we have access to flu vaccine pretty broadly for the fall and going into the winter.
We should probably put this out there that we know that we want people to get flu vaccines, but who should not get a flu vaccine and who should?
That's questions for me. So that's a great question. So we recommend that, and the CDC recommends that individuals 6 months and older get the flu vaccine every year. Up until about the age of 8, if it's your first flu vaccine, you've never had it before, you actually need to get 2 about a month apart. There are some people who, depending on the vaccine or they're immunocompromised, they would not be able to get the vaccine. But and they should speak to their primary care doctors about that. But by and large, the majority of people, again, 6 months and older, should be getting the vaccine. There's also a mist. So if you just can't stand the needle, there's also a flu mist that's available this year, and it's available for people aged 2 to 49. So you can get that as well.
I'd like to move on to the question of testing. And a lot of people have asked about this, that you said that we are at a 2% rate and that's pretty good. But a lot of people say, well, 2% doesn't seem like a high number. What is the target number and why is 2% even a good number?
So that's a great question. And again, we're still learning about this virus and how it spreads. To be honest with you, I wish anyone across the country who wanted a test could get one. And quite frankly, as I said in my remarks, I don't think we're ever going to be there in the United States. So what a lot of experts have said is that if you're testing about 2% of your population a week, that you should be in a good place when it comes to being able to identify people who may have the disease. And I'll just add in there, I know there's been some conversation. The CDC recently, I think, kind of watered down their recommendation on testing asymptomatic people. That's not what we're doing here in the state of Michigan. We know people who don't have symptoms can still spread the disease. And so we are still moving forward with that goal of 2% of our population per week, or about 30,000 people per day. What you want to be able to do, find asymptomatics, and then also respond as quickly as possible to outbreak settings. Again, it's all about knowing who has it and boxing the disease in. Is what a lot of experts say. You do the contact tracing, make sure people are isolating if they're infectious, and that's how you will actually slow the spread of the disease.
Well, then, on I guess the same topic, what is the status of reopening gyms and other businesses where people gather?
So I know there's been a lot in the media. I'll be honest with you, I'm not sure where some of these media stories have come from, but absolutely, we continue to look at the governor's executive orders. We continue to, at the state health department, provide her with the best data and science around what the spread of the disease looks like across the state, and also what's happening in other states. I can tell you that the virus has not changed. We still are seeing outbreaks across the state in various settings, social gatherings, gyms associated with sporting events. So the virus has not changed, but we absolutely continue to look at how we can start bringing our economy back online in the safest way possible. But I don't think that the governor has made that decision yet as far as the next businesses that would reopen.
You know, Rick, I would just add, if you don't mind, that so I'm proud to be a part of the governor's Michigan Economic Recovery Committee, which is a group that advises her regularly on those decisions. Obviously, the governor makes the decisions, but she's enlisted a host of business and healthcare and educational leaders to look at the data regularly that's provided to us by both the University of Michigan and some outside sources and the state to provide recommendations. And I would just say that this is a matter where there is no playbook. There's no guide that you can go back to and say, well, last time this happened, you did X. And so my sense is that Michigan has had, of the states that are hotspot states, when you look at the data around how we were able to contain the spread of new cases, particularly from the June timeframe onward. Michigan has outperformed the majority of states around the country, and so while I know that there's always a challenge with what gets opened and what's not, my sense is that we've done a really strong job of balancing the combination of public health and the economy, because you have to balance both in a situation like this.
Well, since we're on that particular topic, and I'll address this to you, Mr. Lassiter, but feel free, Dr. Khaldun, to chime in, that this reopening has become a political conflict, and that's no secret, with by and large Republicans being concerned that if the shutdown lasts too long, if these executive orders last too long, then we're going to see irreparable damage to the economy, versus the Democratic side of the aisle, and that of course includes the Whitmer administration, saying that the worst case scenario is that we reopen too soon, there's a second wave, and that causes irreparable harm to the economy. And I guess, again, Mr. Lassiter, how do we walk that tightrope? As you said, this is uncharted territory.
Sure. Well, I have the luxury of in regards like this of being apolitical, and so as a business leader, I really try to focus not on the politics of this, but what are the facts that we get presented, and how do you balance? And I'm a big believer in balance is the most appropriate concern here. Obviously, the health and safety of the Michiganders is of paramount importance, and if people aren't alive, then the economy is not relevant to that individual any longer. And so I think that the best thing that we can do is continue to look at data to understand what's happening in our state, but also, effectively we have 50 test cases because we have experiences across the country and what others have done, and we can evaluate decisions that have been made in other states and how successful that decision has been or not. And so I do think that you begin with the facts and begin with looking at data, and you have to end up making hard decisions. And I certainly won't second guess any decisions that the governor and her administration have made, because I do think they have listened to folks who, while they may have varying political views in their private life, when we come together with the Economic Recovery Committee for counsel to the governor and her team, it's purely about the facts and giving our best judgment around what makes sense and what doesn't. And as I look at the facts, what worries me currently about what's happening in the state of Michigan continues to be what happens in sort of long-term care and congregate living facilities, and what happens when there's large social gatherings where there isn't effective mask wearing and social distancing, because those appear to be the two largest areas where we're seeing spreads of cases, as Dr. Khaldun could talk about in more detail than I mean, so I still worry about that. And my sense is if we can control those kinds of things, particularly the latter one, that will give, I think, greater credence to be able to finish the opening of areas that may still be closed today.
Yeah, if I could just add really quickly, I'll just say, I'm also a practicing ER doctor. And the nice thing about medicine, and especially emergency medicine, I've been trained to take care of people and just do the right thing. It doesn't matter if you got insurance or not. It doesn't matter your political background. I'm going to take care of you and follow the medical guidance and the science. And that's what I've been committed to during this entire pandemic response. I look at the data, I look at the science, I care about everyone across the entire state. It's really unfortunate, I'd say, that this has become so political. Something as basic as mask wearing has become something that's political, which I think is pretty absurd. I mean, we're all in this together as human beings. And I think the more we can just focus on data and science and not focus on the politics, the better we'll all be.
What do both of you think has been lost in the discussion. There's a lot of media coverage. I'm part of that. What do you think is an aspect of this that's been obscured by the coverage of the controversies surrounding COVID, reopening, et cetera?
Well, I would highlight maybe a couple of points. Number one, I think it's really important to continue to highlight the fact that that there are great disparities that exist, not just in the state of Michigan, certainly across our country, around those most impacted, and that more light should be given to the fact that we need to address those underlying issues that creates disparities. When you look at the fact that African Americans in the state of Michigan have a 3 times higher rate of disease than the overall population, that's a concern. And while that's gotten a little bit of attention, I think, frankly, that should probably get more attention than it's gotten, as opposed to the squabbles around, the Democrats versus the Republicans in Lansing. And then the other thing that I would highlight, and so I'll take a little privilege, sort of like the proud papa privilege, and to say that highlighting the impact that healthcare workers have had and essential workers have had on fighting this pandemic in our state and across our country. Frankly, I think that there's hundreds upon hundreds and thousands of stories of individuals who lean in ways that go sort of beyond the basic call of duty. And so those are probably 2 things that I would highlight.
And I would echo that. Thank you, Mr. Lassiter, for bringing up the racial disparities. It's quite frankly not a surprise that COVID-19 has impacted communities of color more than others. Again, when you talk about racism and policies like redlining, and the fact that our very orders that were put in place to protect people still had folks who were lower income and working in those services that were deemed essential when everyone else was able to stay home and work from home. There's just no question that we knew, there was no surprise that there would be these disparities. One thing I think that's often not talked about, though, is that as a country, we weren't prepared for this pandemic, but we weren't prepared because there's been such a disinvestment in public health specifically over decades, where staffing has been cut, programs have been cut. There are some places across the country that don't even have a health department. In Detroit, even the health department was closed, several years ago, and now I had the honor of working for the mayor of Detroit and trying to bring that back. But our public health infrastructure has really been decimated over decades, and now we have the pandemic of the century, where, and rightfully so, people want data immediately. They want to understand as soon as someone tests positive. They want the data on our website. They want to understand all of the demographics around those cases. And to be honest with you, our data infrastructure is really outdated, and we're doing a lot of processes that are manual. We're literally doing survey monkeys for some things to get the data back from our local health departments. And again, let me not say I'm incredibly proud of what we've been able to do. And my epidemiology team, we were actually one of the first states to post cases by race and ethnicity and deaths. But I think that there's been a lot of talk about data and getting the data quickly. But I hope that people will also fight for funding public health at an appropriate level, public health and prevention especially, and not just waiting until the next pandemic comes along, because there certainly will be another one. And I think we have to talk about that long term so we can prevent what's happened with this one.
Well, and that is, please.
I'm sorry. Can I just add just to say, I completely agree on the public health side. I've spent a fair amount of time outside the United States and in a couple of places evaluating healthcare in other countries. And what's really clear is that in the country, ours, America, where we have the best medical care in the world from a research and from a high-end perspective, we do have the worst public health infrastructure. And countries that are far less prosperous than us have a much better public health structure. And I do think that's a point that should be highlighted. And let me just add one more point outside of that, which is I also think in terms of what's gotten lost is to highlight the amazing and innovative approach that companies have taken to lean into the medical sphere that were not in the medical sphere before, manufacturing things to help. And what I'm really hopeful of is that many of those companies will continue to do that so that we have a greater US-based supply of medical supplies for our industry. And so I do think there can be more highlighting of that because that's a great opportunity for today and for tomorrow.
Well, Mr. Lassiter, you have just teed up what is also going to be a big discussion both during and post-pandemic, but we're running out of time. So thank you very much for your time in helping us make sense of this confounding situation. And Dr. Khaldun, same to you, and good luck dealing with this crisis. Thank you again for joining the Detroit Regional Chamber 2020 Conversations.
The Detroit Regional Chamber's MPC20 Conversations Respond and Rebuild digital series is provided in partnership with Detroit Public Television and presented by Blue Cross Blue Shield of Michigan, with additional support from Accenture, Bank of America, Barton Malow, Comerica Bank, Consumers Energy, Delta Dental, Dow, DTE Energy, Enbridge Energy, Ford Motor Company, Huntington Bank, ITC, KPMG, the Kresge Foundation, Kroger, Michigan Economic Development Corporation, PNC Bank, Ralph C. Wilson Jr. Foundation, Rocket Mortgage by Quicken Loans, the Skillman Foundation, and TCF Bank. And by these supporters: support for Detroit Public TV's coverage is provided by DTE Energy Foundation and Masco.